It's a Terrence kind of thing. Doesn't matter what you bring. Come and watch him do his thing. Cause it's a Terrence kind of thing. Hey everyone, hey, welcome back to It's a Terrence Kind of Thing. I like to first and foremost say thank you to all my channel members. Tees, Awesome Butterflies, you guys are absolutely awesome. You're incredible. I appreciate all of your love and support. Thank you, thank you, thank you. I'd also like to say thank you to the subscribers, okay? Returning and old subscribers, thank you guys so much, okay? We did it. We're at 200,000 subscribers. I could not have done it without any of you. And that's so serious. I appreciate you all so much. Thank you for watching. All right, let's do a little story time while we drive, okay? You guys check out this beautiful scenery. It's so gorgeous. Actually, I'm leaving work and I'm on my way back to my condo. It's so beautiful out. You see the sun, and I'm so sorry for the blinding glare sunshine, but hey, we're in Florida. What can we do, okay? I want to speak on accountability. I know I talk about that a lot on my channel, but I feel like this would be a really good time, right? Getting off of work, and I've had such a tumultuous week, and I say it respectfully as I possibly can, but accountability goes so far with me personally. It does. I love people who hold themselves accountable, and I love people who take responsibility, especially when they're supposed to take responsibility. So as you guys know, I work in the operating room, and I mean, everyone knows that by now, right? and so obviously I work around a lot of people, and therefore it takes teamwork, right? It takes teamwork to do this job. It really does. And I take pride in it. But one thing that, I mean, there's a lot of things that can potentially discourage me, but one thing in particular that discourages me is when people don't take accountability. For instance, I'm coming in work in the morning, and we're starting a orthopedic procedure, and these are elective cases, meaning they've already been scheduled weeks, maybe a month or two in advance. So therefore, there shouldn't be any discrepancies. Again, my opinion, there shouldn't be any discrepancies about that case, about implants or instrumentation. We all should be on one accord, and we should know what we need. And it's unfortunate when one or two people may drop the ball, and quite often, I'm just being honest, it's unfortunate because, again, this is a job where it requires multiple people holding themselves accountable to make sure that everything is 100% to the best of their ability to make this the most amazing experience for this patient and the patient's family. So with all that being said, there's an orthopedic procedure, and again, we know that this has been scheduled in advance, and it's a pretty serious, in-depth procedure. Not saying that any other procedures aren't important. Every surgical procedure is important. You guys know I take my job very seriously. So now it's super important. So therefore, we should have all the instrumentation that this doctor could potentially need. But why isn't that the case? And it's not just, this is worldwide, you guys, and it's just not one place in particular. I mean, I've been to so many hospitals, and I've worked with so many different people and personalities and attitudes. It's just what it is. And I must say, I don't like to say that, but as I continue to grow in this field, I see that that's really what it is. Some people don't apply themselves. Some people will never hold themselves accountable, because that means that they are responsible. And some people are afraid of responsibility. And let's just face it, you want to make sure you do everything right, and we're not going to do everything right. I'm going to make mistakes. You're going to make mistakes. Everybody makes mistakes, but it's okay. I really, really enjoy, this area. It's so gorgeous. I mean, just look at it. It's breathtaking. But we all make mistakes, okay? We all make mistakes, and that's just a part of life. I feel like once people can realize that, especially in the field of work that I do, I think it could be better. Understand that there shouldn't be a thing where if you do make a mistake, and again, you own up to it, you shouldn't feel like, okay, I'm going to lose my job and everybody's going to hate me. That you shouldn't feel that way. Now, I do believe if an employer has made that a thing, that's probably why people don't want to take accountability, and that's probably why there's even less communication, which is very unfortunate, because it's the surgery, it's the operating room. We need to make sure that we have everything that we need for the patient. So again, doing this orthopedic procedure with a potential with a surgeon, an orthopedic surgeon who doesn't come on a regular basis, that's even more the reason why we should make sure we communicate and we have all the necessary items and like everything that this doctor could potentially want. Now, if he comes in and he asks for something that he did not ask in advance, now that's on him. But if he's asked for these things in advance, which in this case the doctor did, we should have these things available, readily available, readily, accessible for him or her. Not the case though, unfortunately. And then when we're all together as far as a meeting, you now see, okay, who's not taking accountability and who takes accountability. Now, remember when I started this, little story, right? The operating room, it is a field where teamwork is not like, okay, oh, it happened every now and then. No, it happens 100% of the time. It takes the entire village to make sure that this patient, and again, the patient's family, is 100%. Okay, it takes a village. It just can't be on one individual. A lot of people think that the operating room, when you're in the surgery, department, that the doctor, he's a captain. Everything is going to fall on him. If there's a mistake, it's the doctor's fault. No, it is every single individual that is on that patient's chart. That's within that surgery department and within that room. Everybody is held accountable. Don't ask me how I know, but I know, okay? And I know some of you guys know how I know that is true. It is not just a doctor. That's a myth. It's like an urban legend almost, okay? That is not true. Everybody is responsible for that patient. And that's why I say, when we have these meetings, it just can't be put all on one person or two people. Everybody should be held accountable. But I do feel like people who have those leadership managerial roles need to step up and tell the truth, and stop trying to not necessarily tell a lie, but avoid telling the whole truth. That's how I'm going to say it, respectfully so. Now, with all that being said, I think that it would be such a better environment if we can do that and not feel like we're going to be treated in a very disrespectful manner. And I can, for one, say, okay, I can be bothered. Lord knows I can be upset, okay, by some things, but I'm never going to make somebody feel like they're not valuable. We're all valuable. From the individual who is cleaning the operating room, who's cleaning the instruments, from the individual who is passing, who's assisting, like everybody plays a part in this field. And like I said, it's just so frustrating when you genuinely see, because of the experience that you have within the field, when you genuinely see not everybody is taking it seriously and having accountability. That's when mistakes happen. That's when things are not as clear as they should be. Now, again, I want to make sure you guys are following me. Mistakes will happen. It's inevitable. You're going to make mistakes. But I do feel like that it should be to a minimum. If you're doing your job and you're doing it together as a team and you're 100% focused, I feel like less mistakes should be made. Unfortunately, again, that's not something that's not 100%. And unfortunately, it's just going to be more mistakes because, again, people, they don't step up to the plate. A lot of people are not going to take accountability because they're going to feel like, oh my gosh, like, well, they're going to hold me responsible. It's going to be my fault. So I'm not going to do this, or I'm not going to say this, or I'm not going to step up and do this or say this because I don't want to be looked at like a bad person or the difficult one. Well, I'm going to say this. I don't care about being looked at like the difficult one. You guys, take accountability, all right? If you don't get anything from this video, I'm serious. Take this with you. Please hold yourself accountable. Not just in the operating room, not just in the medical field, but every aspect of life. Accountability is so amazing. Okay? It shouldn't be used as a negative thing. It's a positive thing. And when everybody can be on one accord and work together, it's going to be a better experience. It's going to be a better experience, especially in a surgical field, especially concerning the patients and the patient's family. You guys, we have to hold ourselves accountable. All right? I love and appreciate you all. Thanks for watching.
It's a Terrence kind of thing. Doesn't matter what you bring. Come and watch him do his thing. 'Cause it's a Terrence kind of thing.